Okay, student, this is the second part of chapter 64. Chapter 64, part 2. And remember, pay attention to the that's good to know hints that are a cue of what's coming in the final, in the exam, or in the quizzes. Okay? Very good. Physical assessment. Assess of the female reproductive system. A Papa Nicolau test or pap smear, as I explained before. It is also known Papa Nicolau, pap smear, cervical smear. Teach a woman not to douche, use vaginal medications, powder, or deodorant when you are going to have your pap smear, or have sexual intercourse for at least 24 hours before the test, because this may interfere with test interpretation. And that's good to know. No douche, vaginal medication, powders, sexual intercourse for at least 24 hours before the test. Okay? That's something that you need to remember. Also, I want to emphasize that you need to focus your study on all the nursing interventions, pre and post procedures. It's good that you know the general concepts of the disorders or diseases or syndromes, but you need to focus. You're going to be tested on your nursing interventions, especially safety. Okay? The American Cancer Society advises the following schedule for pap testing. Let me add something else. So not only the NCLEX is going to ask you about the nursing interventions and the safety in the nursing interventions, but I am focusing all my tests, all my exams on this. Okay, so kind of giving you a little training before you get your NCLEX. So let's go back. The American Cancer Society advises the following schedule for pap testing. Women should begin having an annual pap test at 21 years age. Okay. Women between 21 and 29 should have a pap test every 3 years if everything is normal. Human papillomavirus test is not to be used for screening for this age group, although it can be used as part of a follow-up for an abnormal pap result. Okay, I want you to understand that. So regularly between 21 and 29, you have the pap test every 3 years. But if you had an abnormal pap test because of HPV presence, then you're going to have a more frequent follow-up. Women between ages 30 and 65 years should have just the pap test every 3 years. Okay? Women older than 65 years who have had regular cervical cancer testing with normal results in the past decade and no serious cancer in the past 20 years do not need further PAPs. Women who have had a hysterectomy can discontinue PAP test unless the hysterectomy was done to treat precervical or cervical cancer. Because usually in the hysterectomy, the fallopian, the ovaries, the uterus, even the cervix is removed. Okay, so if the patient was having precervical or cervical cancer, yes, they are going to do more PAPs because there is a risk that the cancerous tissue involves surrounding tissues as well. Okay. Please pay attention to your NCLEX examination challenge questions from your books. Okay? Pay attention. Look for the right answer. Not only the NCLEX examination, but also the mastery questions at the end of the chapter. Okay? Let me show you. When you scroll down and you see the end of the chapter, you're going to find here, mastery questions before the reference. Pay attention to those questions. Review. It's a great way to review and to be prepared not only for the NCLEX but also for the final exam. Um, a 60-year-old client who has had normal pap results for 10 years and no history of cancer asked about scheduling a pap smear. Which nursing response is appropriate? So for 10 years, he has a normal pap smear and no history of cancer. So the answer is you do not need to have further pap tests at this time. The nurse generalist does not perform the comprehensive female or male reproductive examination. The healthcare provider conducts a more detailed gynecologic assessment. This is done by the GYN. The nurse often assists with the examination. The examination should be performed in a room that has adequate lighting for body inspection, has comfortable temperature, and ensures privacy. The healthcare provider may begin with assessing the breast before progressing to the abdomen and pelvic examination. Inspection of the external female genitalia and the pelvic examination are usually performed at the end of a head-to-toe physical assessment. Assist the patient into the lithotomy position, continuously being mindful and wrapping for privacy. Other than determining pregnancy or infertility, this portion of the examination is indicated to assess menstrual irregularities, unexplained abdominal or vaginal pain, vaginal discharge, itching, sores or infection, rape, trauma, or other pelvic injury, physical damage in the vagina, cervix, or uterus. Speculum examination, the healthcare provider palpates or for symptomatic or asymptomatic abdominal pelvic masses, which can be reproductive, intestinal, or urinary tract origin. Gynecologic masses, such as ovarian masses, may be further differentiated from lesions on the body of the uterus using the bimanual portion of the pelvic examination. Assessment of the male reproductive system, provide privacy within a well-lit environment, and have the patient undressed. The healthcare provider will conduct the physical examination, which may include a breast examination, although men are less likely to have breast cancer than women, but happens, sometimes happens, it's rare, but it's a possibility, especially if the patient has been exposed to radiation, has a high level of estrogen, or has a family history of breast cancer. Okay, these are tests, hormonal blood tests that the provider is going to order. Okay, the estrogen, testosterone, all these tests. The examination is performed by the healthcare provider in the same manner as for female patient. An examination of the external genitalia includes visualization of the pubis, penis, and scrotum. Also, it's going to assess for lesions, the presence of masses for pain, or a prostate examination. If a sexually transmitted infection is suspected, swabs may be obtained at the time by the provider. Laboratory assessment. The human papilloma virus test performed on cells collected from the cervix, in case of the female, can identify many risk types of HPV infection associated with development of cervical cancer. These tests can be done at the same time as the pap test for women at higher risk for HPV as a follow-up for those who have had an abnormal pap test result. And this is a repetition of one of the hints that I highlighted before in my That's Good to Know comments, right? So during the pap smear, you can also check for HPV infection. Laboratory profile. So look at this test. Most of them are high in uh, most of them are high having anorexia nervosa as a problem to causes imbalance in the follicle stimulating hormone, for example, the luteinizing hormone. So nutrition is very important. It's affecting all these tests, all these results. Again, anorexia nervosa and prolactin. Um, that's the important part of nutrition. I'm going to review what is the FSH and LH. These are hormones secreted by the pituitary gland in the brain that stimulate the reproductive organs of both females and males. FSH is a hormone that regulates the growth and development of the ovaries and the testes, while LH is the one that triggers ovulation in females and testosterone production in males. FSH and LH levels can be measured by blood, urine, saliva tests to determine how the reproductive system is functioning. And I'm sure you know this. You're having your OB lesson that is for sure talking about the reproduction. Um, let's go to explain. Prolactin is a hormone that is produced by the pituitary gland. It helps in the development of mammary glands within breast tissues and milk production, has an impact on fertility. Elevated levels of prolactin can inhibit the production of follicle stimulating hormone and gonadotropin releasing hormone, which are hormones that trigger ovulation and allow eggs to develop and mature. So there is a syndrome that I explain in class. It's called the empty cella syndrome. Is when there is problem in the pituitary. Okay, so because of that, prolactin is going to be affected. So all these hormones are regulated by the hypothalamus, the pituitary, all these parts in the brain has a specific role in these hormones. Estradiol decreases, in terms of estradiol, I want to talk to you that there are three major forms of estrogen. We have the estrogen, which is known as E1, estradiol, E2, and estriol, E3. So what I want you to remember is that estrone is the primary form of estrogen that your body makes after menopause. So after menopause, the estrogen is called estrone. It's the same, but it's called estrone. Estradiol is the primary form of estrogen in your body during your reproductive years. Okay, so as we grow, first we have the participation, the active role of estradiol. After menopause, that is called estrone, right? It is the most potent form of estrogen. So estradiol is the most potent form of estrogen during the reproductive years. Estriol is the primary form of estrogen during pregnancy. So you have three types of estrogen. Again, I'm going to repeat. The estradiol, which is present during the reproductive years. Here it is, okay, in the description of the laboratory. Then, if the female is pregnant, you're going to have estriol, right? And then after menopause, is going to call estrogen, okay? Out of the three, the most potent is estradiol, the one from the reproductive years, right? So also we have here estriol, right? Progesterone. In the case of the male, we have testosterone. Increased levels in may indicate possible testicular, extragonadal, or adrenocortical tumor, testosterone resistance syndrome, or hyperthyroidism. We're talking about testosterone. Prostate specific antigen. Elevated levels in may indicate prostatitis, benign prostatic hyperplasia, or prostate cancer. And we spoke about this in part one in this chapter. Okay, so let's move forward in this chapter. Okay, thank you so much. Serologic testing can be used in the evaluation of exposure to organisms causing syphilis, rubella, and herpes simplex virus. Results may be read as non-reactive, weakly reactive, or reactive. A single titer is not as revealing as serial titers, which can detect the rise in antibody reactions as the body continues to fight for the infection. The PSA test is used to screen for prostate cancer in men and to monitor the disease after treatment. African American men are 1.6 times as likely to develop prostate cancer and twice as likely to die from it than are white men. And that's good to know. That's very important part of information of this chapter. Imaging. Mammography is an X-ray of the soft tissue of the breast. Mammogram assesses difference in the density of breast tissue. They are especially helpful in evaluating poorly defined masses, multiple masses or nodules, nipple changes or discharge, skin changes, and pain. Mammography can detect many cancers that are not palpable by physical examination. In young women breasts, there is little difference in the density between normal glandular tissue and malignant tumors, which makes the mammogram less useful for evaluation of breast masses in these patients. For this reason, annual screening mammograms are not recommended for women younger than 40. Also think about the amount of radiation. Even though mammogram doesn't have a lot of radiation on it, but you don't want this woman to be exposed yearly, right? Annually. In older women, this is not uncommon for the amount of fatty tissue to be higher, and the fatty tissue appears lighter than cancers. Cancer and cysts may have the same density. As I said in class, I want you to, it would be very helpful if you download the US Preventive Service Task Force. It's an application where you can see the recommended screening test based on age and conditions. Okay, so look for the US Preventive Service Task Force app and download it. It's very important. Also, you can also download the vaccine schedule by the CDC. Okay, why I'm mentioning this? Because there you can see the schedule for all the vaccines for the HPV to prevent HPV related to cancer, no? Cancer that is caused by the HPV virus. So there are certain vaccines right now that are available for the teenagers and adults until certain age. So you can be familiarized with these two applications. Is the vaccine scheduled by the CDC and this one, the US Preventive Service Task Force, to know the screening you should do based on your age. No dietary restrictions are necessary before the mammogram. Remind the patient not to use cream, lotion, powder, or deodorant on the breast or underarms before the study because these products may be visible on the mammogram and contribute to misdiagnosis. I have included in the supplemental file that I always give you in every lecture. I have included the recipe for the deodorant, okay, that is with coconut oil, organic coconut oil, the baking soda, and the cornstarch. So you can go to the supplemental file and you're going to find the recipe over there. If there is any possibility that the patient is pregnant, the test should be rescheduled. And that's good to know. Okay, you need to know that if the patient tells you, you know what, I'm wearing my deodorant, or I think I might be pregnant, now you need to reschedule that mammogram. Okay, digital 3D mammography allows the radiologist to visualize through layers or slices of breast tissue similar to a CT scan. Compared with conventional digital mammography, digital 3D mammography has been shown to increase cancer detection rates, although it does increase the radiation dose to the patient. So what happened is with regular mammograms, they figure out that sometimes they can misdiagnose the condition, and some extra tests are being done, like for example biopsies, and then they figure out the biopsy is negative, breast biopsies. And with this 3D, they can be sure if there is a specific reason to do a biopsy. However, the amount of radiation is higher. CT scans for reproductive system disorders involve the abdomen and the pelvis. Primary healthcare providers can detect and evaluate masses and identify lymphatic enlargement from metastases. This is another test. MRI uses a magnetic field and radio frequency energy to distinguish between normal and malignant tissues. Is used in addition to mammograms to assess for breast cancer in women who are at high risk or for further diagnostic purposes. I've seen patients that went through the MRI when the tissue is very dense, and with the regular mammogram they cannot identify exactly what's going on. MRIs are very expensive, so for the doctor to decide to go for an MRI after mammogram and ultrasound is because the tissue is very dense. Sometimes, the MRI is negative, but that's why these 3D mammograms are being popular nowadays. Ultrasonography is a technique that is used to assess females for fibroids, cysts, ectopic pregnancy, and masses. It can be used to monitor the progress of tumor regression after medical treatment. Ultrasonography is also helpful in differentiating solid tumors from cysts in breast examinations. For an internal transvaginal or transrectal scan, the transducer is covered with a condom-like sac onto which transmission gel has been placed. Teach the patient to report any allergies to latex, as the condom-like sac is often made of latex. And that's good to know. Safety, 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 safety. Okay, another NCLEX examination that you need to consider and pay attention. Hysterosalpingography is an outpatient fluoroscopy procedure that uses an injection of a contrast medium to visualize the cervix, uterus, and fallopian tubes. This test is used to evaluate tubal anatomy and patency and is commonly done as a part of an infertility evaluation after placement of an internal contraception device or after tubal ligation or tubal reversal. We're gonna watch a video to see the hysterosalpingography. Thank you very much. I would like to say that this test could be very uncomfortable, especially when these structures are narrow. So, for example, if you have a fallopian tube that is having a blockage, think about the pressure of the fluid entering that uterus, right? And following up to the fallopian tube. So if there is a blockage, probably the fallopian tube is going to cause some pain because the pressure does not allow the fluid to go all the way. And during the procedure, this fallopian tube can be swollen, So for some women it's uncomfortable. The examination is best performed on days 6 to 11 from the patient's last menstrual cycle, which reduces the chance for the patient to be pregnant and helps to avoid menstruation. Teach that the procedure may cause some mild and self-limited pain, as I was telling you, as well as a small amount of post-procedure bleeding. If cramping continues after the procedure, an NSAID can be used. If this test if there are polyps or fibroids, right, the pressure of this fluid can dislodge or can move around certain structures. That's where the bleeding is coming from. On the day of the examination, confirm the date of the patient's last menstrual period. Again, ask about allergies to iodine dye. Instruct the patient to contact the healthcare provider if bloody discharge continues for 4 days or longer, and to immediately report any signs of infection, such as lower quadrant pain, fever, chills, malodorous discharge, or tachycardia. And that's good to know. That's coming in the exam. And we have another question, NCLEX examination. Pay attention to that. Look at those 3 possible responses, 3. Okay, let's talk about endoscopic studies. Colposcopy allows three-dimensional magnification and intense illumination of tissue of the cervix, um, vagina, vulva, or anus. Let's see the video. Let's watch this video. Okay, colposcopy.
Colposcopy is a gynecological procedure to examine any abnormalities in the cervix, vulva, or vaginal area, including inflammation, injuries, or cancerous growth. During colposcopy, you'll be asked to lie down in a lithotomy position. When you're ready, the examiner will use a speculum to open the vagina to see the cervix. The examiner will take a clear image of cervix, pre-saline image, before applying solution. A small amount of saline solution will be used to swab the cervix and take images. The examiner will keep applying acetic acid for 45 seconds and take images. The cervix is then stained with Lugol's iodine and takes images. After completion of procedure, the examiner can identify the abnormalities by using the images in the NSV tab. The examination takes about 5 to 10 minutes.
Thank you so much. And that was colposcopy. You saw the patient in the lithotomy position, right? So explain to the healthcare provider, explain that the healthcare provider may take a biopsy specimen while performing the colposcopy. The provider will obtain informed consent and you as the nurse may witness this. So no doubt, no intercourse for 24 to 48 hours before the test. Okay. Also in colposcopy, you are going to explain the patient that it can be used for further diagnosis after a woman has an abnormal pap test or has HPV. Okay. No doubt or use vaginal preparations for 24 to 48 hours before the test. No intercourse. And that's good to know. It's coming in the exam. After the procedure, allow the patient to rest for a few minutes, especially if she had a biopsy performed. The patient should be instructed to refrain from douching, using tampons, and having sexual intercourse for 1 week or as instructed by the healthcare provider. And that's logic, right? It's common sense. After a colposcopy, you need to rest, okay, the area. Okay, dilation and curettage is a procedure in which tissue is removed from inside of the uterus because of abnormal bleeding or to remove pregnancy tissue after an abortion, miscarriage, or childbirth. And even though there are videos available in YouTube, I kindly invite you to look for dilation and curettage videos. I found very disruptive to watch a fetus being removed in the abortion procedure. So you are kindly invited to watch this video. On the day of the procedure, the healthcare provider will obtain informed consent and you may witness the patient signing this. Remind the patient to report having bleeding, heavy bleeding, fever, abdominal pain, or foul smelling discharge to the healthcare provider right away. Also teach the patient that her next menstrual cycle may occur earlier or later than the anticipated date. Laparoscopy is a direct examination of the pelvic cavity through an endoscope. This procedure can be used to rule out an ectopic pregnancy, evaluate ovarian disorders or pelvic masses, and aid in the diagnosis of infertility of unexplained pelvic pain. Laparoscopy is also used during surgical procedures such as tubal ligation, sterilization, ovarian biopsy, cyst aspiration, removal of endometriosis tissues, lysis of adhesion around the fallopian tubes, retrieval of intrauterine devices that the patient cannot self-retrieve. And I want you to remember whatever I explain in class about the dermoids, right? These masses that are next to the ovary that are full with teeth and hair, and they are huge, and they also can be removed via laparoscopic procedure. Okay, after the patient is anesthetized and placed in supine or dorsal lithotomy position, a urinary catheter is inserted to drain the bladder. The operating table is placed in a slight Trendelenburg position, and you know what is it. If you don't remember, you can go to one of my supplemental files. You're going to find a full description of all the positions that you have to be familiarized with in nursing. Okay, so the Trendelenburg position is to allow the intestines to fall away from the pelvis so that the pelvic viscera can be better visualized. Okay, so here is a graphic that explains the laparoscopy. Hysteroscopy also is a procedure that uses a fiber optic telescope to visualize the uterus to diagnose and treat causes of abnormal bleeding. The hysteroscope includes a fiber optic camera that is inserted into the vagina to examine the cervix and the uterus. Because this distends the uterus, cells can be pushed through the fallopian tubes and into the pelvic cavity. Therefore, hysteroscopy is contraindicated in patients with suspected cervical or endometrial cancer, in those with infection of the reproductive tract, and in pregnant patients. So that's good to know. This is contraindicated in all those conditions. That's good to know. Biopsy studies, cervical biopsy. In a cervical biopsy, the tissue is removed for cytologic study. A biopsy is indicated for an identifiable cervical lesion, regardless of the cytologic findings. The healthcare provider usually performs a biopsy in conjunction with colposcopy as a follow-up to a suspicious pap test finding. Patient and family education, preparing for self-management from cervical biopsy. Do not lift any heavy objects until the site is healed for about 2 weeks. Report any excessive bleeding. All you have to double check for all types, signs and symptoms of infection. Do not douche, use tampons, vaginal intercourse for about 2 weeks. Endometrial biopsy. Both endometrial biopsy and aspiration are used to obtain cells directly from the lining of the uterus to assess for cancer of the endometrium. Teach that the spotting may be present for 1 to 2 days, but any signs of infection, excessive bleeding should be reported to the health provider. Instruct the patient to avoid intercourse. Basically, with all these types of biopsy in the cervical, the endometrial, you have, or colposcopy, you have to prevent intercourse, you have to prevent the use of tampons, you have to prevent the use of douches, no douches, right? For 24 to 48 hour pre-procedure, and post-procedure 1 to 2 weeks. Breast biopsy, the patient usually will receive a local anesthetic and the tissue will either be aspirated through a large bore needle, core needle biopsy, or removed using a small incision to extract multiple samples. Educate the patient about how to assess the area or incision for bleeding and edema. Teach the patient to wear a supportive bra continuously for 1 week after surgery or as recommended by their surgeon. Remind the patient that numbness around the biopsy site might last several weeks. Prostate biopsy, we are going to watch this video. We are almost done with this chapter. As I'm telling you, there's a lot of information and you need to be aware of this. So basically, that's the prostate biopsy. And after the biopsy, remind the patient that he may experience a slight soreness, light rectal bleeding that is bright red for a few days, and moderate hematuria that should resolve in a few days. Of course, if you have hematuria for many days and the bleeding is heavy, you need to report that, right? Tell the patient that semen may be discolored, red or rash for several weeks. Pain can be treated with over-the-counter acetaminophen. NSAIDs should be avoided due to the risk of bleeding. And I shouldn't really repeat that, right? We know that NSAIDs causes bleeding. So you're going to treat this condition with Tylenol. Um, Teach the patient to contact the healthcare provider if he has fever, prolonged or heavy bleeding, as I mentioned, worsening pain, swelling in the area of the biopsy, or any difficulty urination. And all of this is good to know. Okay? All these facts are good to know. So, after this chapter, at the end of the chapter, you see the mastery question. Okay, that's good to know. Every chapter has mastery questions, and every chapter has the NCLEX challenging questions. So Professor Matalana is taking questions from everywhere. From the test bank of this book, from the NCLEX, from the mastery question, from other sources. Okay? So I gave you several hints, and I just want to emphasize that all the questions that are coming in the final, I personally made sure, even if I use other sources to question and to prepare your exam, I guarantee 100%, I made sure all the information is in the chapters. So I'm not testing you, not even one question that is not included in your book. Your book is your best friend. That's why I strongly suggest you to read and to study and follow the videos. Have a good afternoon. This is the end of chapter 64.